My name is Nilesh Vasan, and I'm here to talk to you about transaxillary robotic thyroidectomy. This is a procedure whereupon we perform an incision in the armpit or axilla to access the thyroid gland. Now, this might sound pretty strange, but the majority of people who have thyroid tumors or cancers are women. And a lot of those women are aged between the late teens and early 40s. And as a young woman, they probably would not like to have an incision on the neck. It was not so long ago that surgeons performed a very large incision on the neck, which was there for everyone to see. And as time developed, surgeons became more conscious of this, more conscious of the patient's wishes not to have a visible scar, and the incision length began to be reduced significantly. At OU Medical Center, we routinely perform operations on suitable patients with nodules using incisions between, say, 3 and 4 centimeters. However, there are women who do not want to have an incision at all. And in Southeast Asia, where a lot of women, for cultural reasons, do not like to have visible incisions, surgeons in that area of the world have developed a technique to perform scarless thyroidectomy. This has developed over many years, and more recently in South Korea, a colleague has developed a technique of performing thyroidectomy through the axilla or armpit. Now, this might sound pretty fantastical, but it can occur. We can actually perform an incision and advance our instruments through the armpit to access the thyroid safely. This is performed using the Da Vinci surgical robot. And what we have with this particular tool is high magnification, high definition resolution, 3D imaging, and tools that allow more dexterity than the human hand. And in this way, we can access the thyroid and view the very important structures which are right next to the thyroid, including the nerves and vessels. We've performed numerous surgeries at OU Medical Center, and the complication rates are similar to those of open or routine surgery. That is very low. Patients look exactly the same after their surgery as if they were going into surgery. There are no marks on the neck whatsoever. This is something that we think will help us in the future in designing further procedures within the upper chest or lower neck. And hopefully, as time moves on and the technology advances, we may be able to perform more procedures within this area with minimal side effects.